Good morning. My name is Ralf Friedrichs. I'm an author, an addiction recovery coach, a life coach, and the host of this show, the Take Your Life Back Today radio show. You can see a video version of this if you go to Take Your Life Back Today show on channel, Take Your Life Back Today show on YouTube on channel Take Your Life Back Today show. I want to go over some answers to most of the pressing coronavirus questions been sent in to me. First one, what are the symptoms? Well, fever, dry cough, difficulty breathing are hallmarks of coronavirus. Symptoms may appear anywhere from 2 days to 2 weeks after exposure. Another question from someone is, how does it spread? It primarily spreads between people through respiratory droplets. Think coughs, sneezes, and spittle. You can also get coronavirus by touching infected surfaces, then touching your mouth, eyes, or nose. Another question, how long does coronavirus stay alive on surfaces? Up to 3 days depending on the surface. The new coronavirus is viable up to 72 hours after being placed on stainless steel and plastic. Another question is, why is the disease called COVID-19? On February 11th, the World Health Organization announced an official name for the disease that is causing the 2019 novel coronavirus outbreak, first identified in Wuhan, China. The new name of this disease is Coronavirus Disease 2019, abbreviated for COVID-19. In COVID-19, CO stands for Corona, VI for virus, and D for disease. Is there a cure, somebody asks, and why is it taking so long? There's currently no cure for the novel coronavirus, and while research is underway, it could be more than a year before a vaccine becomes available. The antiviral drug must be able to target the specific part of the virus life cycle that is necessary for it to reproduce, according to Harvard Medical School. In addition, an antiviral drug must be able to kill a virus without killing the human cells, or the human cell that it might occupy at the same token. Once you have coronavirus, will you have it forever? That's a good question. The American College of Physicians found it takes 5 to 12 days for symptoms to show. They said more than 97% of people will show symptoms within 12 days. This fits the CDC recommended 14-day quarantine to show symptoms and then take time to recover from illnesses or an illness itself. Can we kill it by inhaling boiling water steam? Like in India, they use this during flu and cold or cough. The WHO says this will not work to kill the virus that's already entered into your body. Myth busting. Which of these DIY home remedies for coronavirus are actually effective? Well, can you have coronavirus without upper respiratory symptoms? Every human has a unique biology that will react to the virus in its own unique way, wrote Nirago. So yes, you can have COVID-19 without classic upper respiratory symptoms. Symptoms associated with COVID-19 are generally flu-like, which encompasses a broad range of symptoms including fever, headache, muscle aches, cough, runny nose, and fatigue. Another question, how do you know when someone is recovering from coronavirus? Another good question. According to Harris County Public Health, the patient has to be free and clear of any symptoms. Then the patient has to have a negative test result for the virus and then be tested again in 24 hours. After the patient tests negative both times, they are considered recovered. I hope that clears up that question. Somebody wrote, I have a mammogram, sleep study, dental visit. Should I reschedule? This is a really important question, but the CDC and prevention encourages that people in our community most vulnerable to coronavirus to stay home as much as possible, avoid crowds, and reschedule non-essential doctor appointments, not emergencies, but non-essential. The vulnerable population includes people 60 and older, people who have weakened immune system, and people with underlying health conditions such as heart disease, lung disease, or diabetes. Will ibuprofen worsen the virus? There was a lot of concern after the French Minister of Health tweeted to avoid anti-inflammatories because they might worsen an infection. However, the World Health Organization told NBC News they are not aware of the data that's true. If you are concerned, experts say you can take acetaminophen to control a fever, one of the main symptoms of the virus. Hopefully you don't have that. Another question, is coronavirus especially harmful to pregnant women? Long story short, there's not enough data yet considering this coronavirus just emerged in humans a few months ago. The vulnerability of older adults has been well documented, but researchers do not have information from published scientific reports about susceptibility of pregnant women to this coronavirus, the CDC says. Adverse infant outcomes like premature births have been reported among infants born to mothers who have tested positive for coronavirus during pregnancy, the CDC says. Another question, what are the hospital CEOs doing to provide beds? Will they be ready if there is a spike in coronavirus patients? That's exactly why these drastic measures are being implemented. Then, or when you hear flatten the curve, it is because leaders need to bring down the number of potential coronavirus cases below the curve to a number that hospitals can handle. This entire hype is because hospital beds. We see this happening in other countries, and it's the reason China has a higher number of deaths than anyone else at this particular time. If I visited an emergency room in the past couple of weeks, how would I know if I'm at risk? Well, it's like this. Rest assured that that over the last few weeks, most hospitals have been working, and I mean working, to monitor and isolate patients and visitors with travel-related risk factors or potential contact with infected people. Okay? So I hope that answers it. Does donating blood get infected by coronavirus is another question. At least 4.5 million Americans need donated blood every single year, but this is the first time novel coronavirus has been a concern in the nation's blood supply. Individuals are not at risk of contracting COVID-19 through the blood donation process or via a blood transfusion, since respiratory viruses are generally not known to be transmitted by donation or transfusion. Did that answer that one? What if you do have some of the symptoms, like a cough and a sore throat? No fever, no runny nose. Do you go to the doctor? Do you call the health department? What should I do? Well, no, do not go to the doctor. You are considered low risk. Low to moderate risk patients are not being tested at this time for COVID-19. Self-quarantine is recommended when you see any signs, whether it's one or all, until tests become available, but contact your local primary care provider for guidance if you feel better doing so. I am wondering why the CDC isn't testing more for the coronavirus. The tests, labs, and equipment necessary to run tests for COVID-19 are limited. Production is ramping up, though, in the last week or so. Is there an eventual plan to test people without a doctor's order? Currently, CDC guidelines makes it clear that Americans can be tested with a doctor's order because test supplies are limited. Those who are severely sick or who were in contact with known cases of COVID-19 are prioritized. Could we all be silent carriers at this particular point right now? Could I be a silent carrier? Clinical research supports the idea of subclinical carriers, patients with mild disease, but silent carriers have not been identified as of right now. How do we know if we need to be tested for COVID-19? It is flu and allergy season right now. If you have the symptoms consistent with COVID-19, runny nose, sore throat, cough, fever, shortness of breath, and have been in contact with an individual with known case of COVID-19, then you should assume that you have COVID-19. Self-isolate yourself and contact your local physician. If I get a pneumonia vaccine, will that help protect me from coronavirus? Good question. Some cases of coronavirus do lead to pneumonia, but the pneumonia vaccine won't help at all. Period. Can I have the flu and coronavirus at the same time? Another good question. Boy, you guys are sending me some good questions. If I test positive for the flu, does that mean I don't have coronavirus? Lots of readers and viewers are asking this since it's difficult to get coronavirus testing in many areas. So, but there's no reason why you can't have both flu and coronavirus. I mean, they can both go together. They're very similar in damages to your body. If a person gets well after having COVID-19, could their blood be used to make a vaccine since they have antibodies now? Currently, there are no vaccines or drugs available to treat COVID-19. There are many in rapid development, and some may be available in a short time. Folks, these are a lot of the questions that were sent in to me, and the list goes on, but I can only do the show for so long. So, thank you for sending me the questions. Call me at 844-405-HELP. Together we can help each other take our lives back. Remember, you can email me at takeyourlifebacktodayShow@gmail.com or Ralf.Friedrichs@Yahoo. You can also practice one thing that's really important. That is to help the elderly around us. Help them as much as you can, but be smart about it. Try not to go too close to them or touch them because you might be carrying or they might have it already. But help them. Help them bring their garbage cans and help them in any which way you can, but help the elderly. And always remember that God truly blesses those who bless others. God truly does. I hope you guys get a hold of me and ask some more questions. I still have some questions I can go over, but I don't have the time for it, but we will do it on another show. May God bless each and every one of you, and we'll talk to you guys all tomorrow. May God bless you. Take care.